In the year 2006, we held a seminar in Tulsa, Oklahoma. An extensive group of decent doctors attended, an ENT, a surgeon, an immunologist, and general practitioner, and others. We spoke for hours about the lymphatic system and how shall we approach the treatment. An ENT readily proclaimed afterward. He said, "Get your patent ready for the USA, and you are going to be the richest doctors in the world." He continued, "There are tens of millions of mouth breathers across the United States, and you have a method to treat them all." It is true, 80% of patients hardly get any proper treatment. It is mostly limited to "here is your nasal spray, some hormones, antibiotics, pills, have a great day, have a great day," at all. But we will get to that later. Now about your nose. You cannot breathe freely because the air you inhale obviously cannot go freely through your nostrils and nasal passage. The passage of air is somehow limited. It is narrowed or even fully blocked. For now, please do not even mention your nasal septum. It is rarely about it. It is all about inflammation. What is inflammation? Inflammation is protective response of your organism to an external or internal threat. Inflammation involves immune cells, blood vessels, and molecular mediators. It is a mechanism of innate immunity. Immunity itself is not a physical substance. It is a feature that is almost fully performed by the lymphatic system. Inflammations are characterized by heat, pain, redness, some loss of function, and swelling. The latter, the swelling, is the one we need. The swelling leads to enlargement of the tissues. Even the tissues in your nasal passages, thus causing their narrowing or complete blockage. Now, why does inflammation happen in the first place? Inflammation actually is part of the way we were created. And yes, I believe both in science and in intelligent design by a creator. Inflammation can be acute and can be chronic. If inflammation works well, acute inflammation should generally resolve when the threat is taken care of by the lymphatic system. The threat can be external, a viral, bacterial, or fungal infection. Inflammation involves many cells and molecules to eliminate the threat and initiate a repair process in the tissue through a series of biochemical reactions. If there is no inflammation, there is no immune response. There is nothing to stand against the infection. The lymphatic system is very much involved in this process. It is the infrastructure for the immune response. It cleans out all the waste. And let's have a closer look to the lymphatic system.
The lymphatic system is a unique one that performs drainage, detoxification, and immune functions. It all starts with the lymphatic capillaries that absorb toxins, microorganisms, and even cancer cells. Then the lymph goes through the lymphatic vessels to the lymphatic nodes. The lymphatic nodes eliminate the wastes and releases the pure lymph. The pure lymph then, on its turn, goes further into the bloodstream through the very special piece of the lymphatic system that is called the thoracic duct. The lymphatic system protects all the organism from bacteria, cell wastes, and even cancer cells.
But if the lymphatic system and hence the immunity is weak, and therefore skilled acute inflammation can become chronic, meaning it is there constantly that shows up when you get cold and calms down afterward, but never goes away completely because your immune system knows the foe is still there, but it cannot cope with itself. It needs professional medical intervention, which is reluctant to come. Okay, let's go forward. Moving closer to your nose, the lymphatic system covers your whole body and internal organs, your throat, eyes, ears, nose, even your brain is taken care of by the lymphatic system. For instance, if you get an infection, your lymphatic system is there for you to perform the immune function and eliminate this bacteria. But usually, all we know about this vital organ is that our doctor will check our neck for swollen lymph nodes when we visit him complaining of a cold. But do we know how it is one of the main keys to our health? Here is an illustration for it. This is a picture of the lymphatic region of head and your neck. What are the most common names for the first according to our experience? These are bacterial, Staphylococcus, mostly aureus, DNA viruses, a triad, CMV, EBV, HHV, 6 and H, and several fungal infections. How do doctors fail to treat? Epic fail number 1. Insufficient measures. Too many drugs. Okay, suppose you have a cold. You feel the inflammation as congestion and stuffiness in your nose. Your running nose tries to produce more mucus to eliminate bacteria and get them out. Your mandibular lymph nodes are enlarged. Your lymphatic system works hard. Sometimes not enough, and you get some cough because the infection goes to the bronchium and lungs. It seems to go away after 5 or 7 days, maybe with a bit of a fever, but soon it comes back and you seek a doctor's advice. He generally prescribes some drugs, sprays to reduce the swelling, some antibiotics to kill the infection, never actually knowing which one. And it helped. It gave you the relief you wanted. For a while, everybody seems to be happy, especially the doctor and the insurance company, whose standards are fulfilled and expenses are low. But your lymphatic system is not happy at all. Your immune system is still alert and frustrated. The enemy masks itself behind the absence of clear symptoms. It sits there constantly, irritating your immune system and manifesting itself from time to time. Every time it shows up, you just push back the symptoms with the standard procedures like sprays and pills, cutting the tip of an iceberg, but neglecting the underwater part. The infection resides there untouched and leads to disastrous complications which can show up in 20 years' time from now. Or you can see them now because 20 plus years ago no one was there for you to put this viral infection into the irons of the immune system. We will speak about complications in part number 3. Fail is that in the modern world, in the immune system cannot cope with the infection itself in 96% of the population, and measures taken are insufficient and prescribed with blind eyes without proper and thorough diagnostics. Intermittent, illogical intake of antibiotics makes the bacteria resistant to it. Epic fail number 2. Unnecessary excessive measures. Crazy surgery. Children and young adults who frequently suffer from a sore throat, tonsillitis, laryngitis, or runny nose, rhinitis, sinusitis, almost always get recommended to have their palatine tonsils out. Palatine tonsils are a unique barrier that protects your organism from further spreading of infection. It is a shield. And of course, it suffers the most. Of course, it hurts. But do not remove it unless there is a malignant tumor inside. We recently had such a case in our clinic. What happens when they are out? Your strongest organic defense system has just been stolen. Now we know that our organism is marvelously crafted to adapt. As a compensatory mechanism, the pharyngeal tonsil is enlarged. Usually they call it adenoid. It is now enlarged and again decreases the passage of air. So, the wrong tactic is to knock it down too. Here are some stats. Removal of palatine tonsils doesn't decrease the incidence of upper airways infection, but increases the incidence of diseases of the upper respiratory tract by 300%. Removal of the pharyngeal tonsil increases the risk of chronic obstructive pulmonary diseases. Have you had your tonsil removal, and at what age did it happen? Epic fail 3, what we call the nonchalant approach. When your doctor just says, "Have a nice day," but it is not just the doctor who becomes impassive, it can also be the patient. The former doesn't bother to provide the simple tests like laboratory scripts of your nasal cavities, a simple CT of your nasal sinuses, or basic immune profiling. They are first to interfere with drugs illogically and unsystematically. They refuse to think because it is not in common practice, or what would you colleagues think. They do not recognize the risk. They do not take action. What about us? Unlike many, we commit our time and engage every machinery and piece of the brain. We have to find the reason and custom build a treatment program. The latter, the patients, do not seek desperately to find the solution. No insults, but we are responsible for our bodies and how we maintain them. We need to seek in order to find and to knock for the door to be opened. Do we want to live long enough to be able to enjoy time with our children? of our grandchildren. For those of us who believe in God, there are several texts in scriptures encouraging us to take care of the body. Our favorite and comprehensive one is in 1 Thessalonians chapter 5, poem 23. May God Himself, the God of peace, sanctify you through and through. May your whole spirit, soul, body be kept blameless at the coming of our Lord Jesus Christ. For those who believe that life ends here on earth, do we want to die with pain from sickness or without? We just had an American patient with leukemia, a very noble gentleman, 70 plus, fit, eating healthy, fighting for his health, struggling to find answers for his struggle with leukemia. He finally flew here to Pam, and what we found out hit us like a bullet train. For 10 years he had been suffering from acute facial pain, with doctors knowing there is something inside causing the pain, and doing nothing except constant painkillers. And let me be clear here, regular intake of painkillers increases your risk for stroke. Moreover, this content fungal lesion in the sinus was so huge, and it was target to the immune system for so long that this target may have driven for immune system mad, attacking its own body, resulting in cancer. This is a clear and unfortunately typical example of a nonchalant approach of insurance-based, standard limited, time-limited, brain absent healthcare. We of course killed the pain instantly with lymphotropic therapy injections. Then we rebalanced immune system. Then we sent him over for surgery to remove the fungal lesion. He chose to do it back home. The source of pain is now almost completely gone. The inflammation point is resolved. The blood work already shows a steady decrease in white blood cells, promising that cancer, his particular type of leukemia, will step back. It is still a way to go. Cancer never gives up that easy, but in this case, we believe we found the root cause of cancer. We try to fight it back to the very victory of life. So, serious immune system disbalance is just one of the long-term consequences of persistent infection somewhere inside you. We are now moving forward to part number 3. Ramifications. What ramifications can this constant infection, single or multiple, do to your health? You already heard about some issues with the immune system, increased incidence of respiratory tract diseases, even cancer. What else? We will split them in 2 groups. The first is naked and envious. Second is tricky and misleading, at least to those who didn't study the lymphatic system. First group. These events are obviously connected to your nose. Otitis, disease of ears, hearing impairment, buzzing of ears called tinnitus, and chronic cough. Second group. These are that require some thinking, snoring, and sleep apnea. Constant inflammation narrows the airways and makes the air sound differently when passing through. You thought snoring is an overweight problem that alternates the shape of the palate. It is really more related to infection. There is not point in CPAP unless you deal with infections. Your lungs suffer as well. Inflamed airways cause a pause in your breathing while you sleep. Thus, you don't have enough rest because you do not have enough air and oxygen. Here comes the bronchial asthma as well. You consume at least 3,000 gallons of air daily and much more when you wake out. If your airways are narrowed by constant inflammation, there is a shortage of oxygen delivered to the brain. The infection as well, have just seen, infiltrates the lymphatic nodes and blocks the lymphatic system. But drainage from the brain goes through the very same draining system. If it is occupied by infection, there is no proper drainage. Here, there are very possible routes for headaches and hiding. What is more, lack of drainage and lack of oxygen cause intracranial hypertension, means increased pressure inside the cranium. There is increased amount of liquid in the brain and it can compress some parts of it. For example, hypophysis. Let's take a man, for example. Hypophysis regulates hormone production, One can be chorionic gonadotropin, which is raw material for testosterone. Low hormone levels lead to obesity, blood pressure, and low sexual function, and others. If you had your tonsil removed, it affects your thymus. It is a small gland behind your sternum group. It produces T cells, your immune system agents. It's very, very important agents against infection. Moreover, your digestive tract is being regulated from the head as well. The thyroid gland is a tender substance, but knowing it is linked to the very same lymphatic system with your nasopharynx means it gets affected the first. Have you heard about autoimmune thyroiditis? And again, it is responsible for hormone production, and hormones that is produced are responsible for dozens of biochemical reactions in the organism. Infections can go to the brain itself, especially when tonsils were removed after multiple causes of mononucleosis. Herpes family is so naughty they can affect the neural system, causing the pain to appear here and there. Persistent Epstein-Barr virus is even proved to be oncogenic, which means triggering cancer. Constantly infiltrated lymph nodes, for instance, is a quick lane to lymphoma. Remember, 90% of nasal congestion comes from unrecognized, untreated chronic infection that can go elsewhere, causing all kinds of complications, even pain of unknown origin. Infection can be bacterial, viral, or fungal. Okay, we got it. You say, what can we do about it? Let's move to part 4.
Okay, step 1. We first need to round up all symptoms that you have. Let's start with the simple one. Is there any stuffiness in the nose? or nasal congestion. If you have had frequent colds, if you are having them more than one episode in a year, it is considered frequent. Snoring, chronic cough, mood variability or even depression, headaches, or any other chronic pain, probably elevated blood pressure. Go through them thoroughly. Tick the ones that you have right now. And we move forward to step 2. Step 2. Sum up your medical history. The things you probably had during your lifetime. Episodes of shingles or mononucleosis. If you have had your tonsils removed, adenoids, or any other surgery. Bronchial asthma in your medical history. Probably pneumonia. Or you probably had any other disease that is considered serious or chronic or infectious. Step number 3. Let's do the following test altogether. We need to test our nasal breathing. Number 1. Take your finger and gently hold one of your nostrils that it cannot breathe in some air. Then breathe in and breathe out slowly and deeply using the other nostril. How did it go? Do you breathe freely with this nostril or not? Now try the very same thing with the second nostril. Hold it with your finger gently, then breathe in and breathe out deeply and slowly. Do you breathe freely? Point attention to that. Do you breathe 100% freely without any noise, any obstruction on the way of the air, or you don't? Step number 4. Take all that you've got, your symptoms, your medical history you revised, and this test of your nasal breathing, and visit your GP. And tell him this one. I suspect I have chronic infection that affects my immune system based on symptoms I have and on my medical history and the thing that my nose currently doesn't breathe freely 100%. I don't like that. Can you please investigate it for me? Physician can probably deny you have any problems at all. So this is the time we move to step 5. Get some tests done. Let's start with a simple inoculation for bacteria from fauces or cheek inside and from your nose. They take the special scrapes from it and send it to the lab, and they investigate either some bacteria grow there. Second scrape will be for PCR tests, so-called. This to check the DNA of viruses that remain somewhere in your throat or in your nose. The third one is a blood test for the same very viruses, but the PCR now tests the blood, if the virus is in the blood. All 3 are being routinely done in any lab across the globe. Number 4, go for a CT scan, computer tomography scan, for the nasal sinuses. And please, no X-ray. X-ray cannot show the details the physician needs to investigate the condition of your sinuses. 5. Go for the MRI of the brain. If you had this nasal congestion for a long time, it can probably affect the lymphatic system already, causing extra fluid being gathered in the brain, or even had some consequences on it. We need MRI for the brain, and your physician would need that to investigate the condition, especially if you have headaches, hormonal problem, something else. Number 6. This one is the immune system profiling. It is a simple blood test, and a lab physician will investigate it for the layout of the types of the cells that inhabit your blood that belong to the immune system. All of that we listed in these 6 points are routinely easily done here in Russia by order of a patient himself. No physician is needed, no referrals is needed. You just go for the lab, you go for the CTs or MRIs, and they do it for you. These are the critical data you need to investigate your immune system and the condition of your nasal sinuses, of your nasopharynx. Step 6. We now need to treat bacterial infection. That is regularly being done by antibiotics, but the critical point here is to choose the right drug. You do not just go simply for the universal drug for every kind of bacteria or for the strongest one. It doesn't work this way. Once you get your tests, they're gonna put there the right drug you need to treat this or that bacteria. Treat viral infection if you found them. This is a bit tricky because you never treat viruses with antibiotics. Antibiotics are designed to bacteria, to treat bacteria, not the viruses, right? So you have all these 7 steps now. If eventually, after the tests that had been done, you cannot find anything inside it, seek for professional advice. If the lab keeps saying there is nothing in the tests, there could be that, for instance, a virus had gone deeply already into the blood or into the organs and resides there and doesn't show up on your in your throat or in your nose. So these are the 7 steps we would like you to have as takeaways for you to be able to restore your nasal breathing, to claim it back. And these very steps will be critical and necessary for you to go and stop any possible ramifications